Hello, everyone. This is Dr. Parks, and I am going to be briefly talking about health behavior, health education, public health related careers. So, Chapter 17 of our textbook wants to just remind you how important knowledge of health behavior is, how important it is that we develop evidence based programs, and that we really consider all the factors that go into informing health behavior of differently, again, evidence-based. And so a knowledge of social and behavioral theories is really important in public health and health promotion and in any health services career. And so chapter 17 provides a couple examples and discusses different career options. So if you're specifically really interested in public health, even if you're a psychology major or a political science major and you're taking this class, maybe you're a public health minor or public health major, but you're really interested in expanding your knowledge of public health and wondering what careers are waiting for you on the other side. A lot of folks who work in health education, health promotion, health behavior change, work in government, public agencies, local agencies, counties, city jurisdictions, state agencies like the Tennessee Department of Health, federal agencies like the CDC, like SAMHSA, and some of the other agencies we'll talk about throughout the course. There's also opportunities in the nonprofit and what we call CBO, or community-based organization environment. So you may be designing and implementing programs. Maybe they're funded through grants or local nonprofit efforts, fundraising efforts, philanthropists, any work to advance the health of communities, working with community-based organizations, likely involves some understanding of health behavior. And then, of course, we have private sector consulting. There are groups that provide what we call technical assistance. They provide expertise to the government, to agencies, and they operate as private organizations doing that. We also have private industries that work to either inform industrial hygiene, so workplace health, occupational health, help design programs in educational settings, community settings. So when we say private industry, quite often there's these groups that are workplace focused, and that's a little bit different than the community-based private sector consulting organizations, although similar work is being done, similar competencies being leveraged. We also have healthcare providers. So if you're working as a healthcare provider, maybe you want to be a health educator, working either in the community-based setting or in a hospital, in a clinic, talking with folks about their health, helping bridge the gap, helping educate. Maybe you're a CDE or a certified diabetes educator. All of those areas we use and leverage health behavior frameworks. Now, academic settings, right? Like a university, we think about, we develop theories, we test theories, we do research, behavioral and theoretical research, but we also design and roll out programs. We call that community engaged research, community partners. We train individuals, we disseminate ideas. And so these are just some examples. Now we're going to take a little departure for the next 10 minutes or so in a different direction. And I want to use the remaining part of our time together to talk about careers in public health. So this is a lecture that I put together quite some time ago on careers and educational opportunities in both healthcare and public health. And so if you're interested in health services administration and running healthcare programs, or you're interested in public health, health behavior, you're aware of opportunities that exist. And so I just want to talk through those for a few minutes. If you have questions, please seek me out. I'd love to talk specifically about your career goals and what might help you get closer to those goals. So this is a list of job titles, and I'm going to read through them really quickly. Quality or clinical data analyst, a quality data analyst in a hospital, a health educator, also referred to as chronic disease prevention coordinator. We have a project manager rolling out projects in a public health setting or a healthcare setting. We have a quality manager looking at data in clinics and hospitals. We have a manager of decision support, again, looking at data, but looking at financial performance and contracts and quality performance in a hospital. We have a director of quality and risk management who is in charge of lowering the risk, but also improving the quality of care being offered in an inpatient setting. We have a director of a program management office. This would be an office that rolls out different programs. We have a director of managed care, which is a director in a health plan setting. a research associate, working in health services research. These are all examples of careers I've had. I've also been a professor and a program director for different academic programs. So this is just me. This is my last 20 years. I've worked a lot of different roles and at different times and overlapping. This is one person and their trajectory. Think about all the roles you could work in. So I just want to show you the varied career, and you don't have to choose one thing or just be good at one thing. So quite often when I go through this, I like to talk about future career paths, differentiating between what it means to work in health services administration or healthcare management and public health. Are you more interested in the idea of information systems that support health of populations? Or are you more interested in epidemiology and health education and working to improve the health of a certain group? So these are different disciplines, right? But a lot of overlap, and I've worked in both off and on throughout my career. These are some settings, domains, roles in both. So if we just pause here for a second, you can see if you go into health services administration, there's a lot of folks who work in inpatient and outpatient care, clinics and hospitals and health insurance plans, consulting firms, skilled nursing facilities, mental health organizations, in all sorts of roles. Sometimes they're working in human resources, insurance, HR, finance, quality improvement, right? That's healthcare management side. And then, of course, we've got policy often gets grouped in there, but our efforts to create laws to make folks more healthy. On the public health community side, you'll see different roles. Things like a health educator. Maybe you're doing community health outreach, working with community-based organizations, working with community members. Maybe you're working in epidemiology or statistics or doing research. Maybe you're doing needs assessments to see what the community needs to implement new programs. Maybe you're working in environmental health, making sure our food, our air, our water is healthy. Maybe you're helping prepare for emergencies, right? Or working in some sort of public health information officer role, sharing health information, maybe working as a planner, right? Lots of different opportunities here. So healthcare management on that side has some very specific domains and some very specific competencies as it relates to leadership and communication and strategy. And so this next slide is all about different roles and pathways available for those working in healthcare management. So if you're at all interested in health services administration, this is some examples of some of the settings that are common. We've got the health set systems like hospitals, long-term care organizations, clinics. We call that ambulatory. We've got health plan administration. Maybe you work in a health maintenance organization or a PPO. Maybe you go to work for Blue Cross Blue Shield of Tennessee. Then we've got pharmaceutical vendors, pharmaceutical producers. We've got different types of vendors, suppliers who make things like wheelchairs, technology, tech companies that make electronic health records. So these are some examples of settings, places that folks with a background in health services administration might work. And then these are what I call the domains or the subfields. I've had friends call these sub-disciplines. Things like leadership and strategy. If you're really interested in leadership and strategy, but you like health and you want to serve a patient population, these are all live links in our online course. So if you click through the lecture that's posted, these link out to different certification opportunities, education opportunities in leadership, in project management, in finance, in quality, compliance, ethics, HR, and IT. So these are all different opportunities you can explore and see if any of these appeal to you. And I recommend clicking through some of the links. If you're like, oh, I don't like any of this, I wouldn't want to do this in my life. Maybe the true public health side, or maybe another field is better suited to you. But this gives you an idea of health services. And I always say that folks would be interested in healthcare management if they want to work in a healthcare oriented business, a hospital, a clinic, a health insurer, a mental health provider. They want to work in a managerial capacity. They don't want to deliver care. They want to organize it. They want to strategize. You may also be very interested in one of those subfields I just showed you. HR might appeal, IT, strategy, finance. And you know, public health, as far as being a health educator or community health worker, that's not what you're looking for. If so, you may be interested in healthcare management. Now, we've got a few different fallacies about healthcare management here. First of all, it's not just a one and done. You can't just get a bachelor's degree and become a CEO of a hospital. Requires a lot of time, effort, and energy in order to develop your craft. And it's not one single career path. There's a lot of folks who pursue different roles, different subdisciplines, right? For example, I worked in healthcare quality, but also healthcare finance. I also worked as a director for a project management office. Those are different roles, different backgrounds. And so, in order to do that, you really need to obtain a master's degree, either a master's in health administration, a master's of public health, or a master's of business administration. I have an MBA and an MPH. A lot of my colleagues have MHAs that work in healthcare admin, but some graduate degree that shows that you're prepared to lead and organize. And below are a couple suggested certifications. And so is the next slide. If you go back to the slide with the grid that lists out all the certification links, that's where you'll find the links to all of these certifications that I recommend for healthcare managers. Now, if you consider a career on the management side in health, there's huge booms. That industry is growing about 32% in this decade. We're looking at about 51,000 new job openings per year for health services managers. And we're going to see huge growth in states like California, Connecticut, Florida, Massachusetts, New Jersey, New York, Rhode Island, Washington, Oregon, and Vermont is where they anticipate a ton of growth. And also those tend to also be the states that pay really well. Higher cost of living though. So something to think about. Now, when we think about a career in health services administration, the salaries, the starting salaries range between 50 to 60K, moving up to an average, a mean of 185, with a median of over 100K. Now, the median, the average value is skewed by some very big salaries. There's people who work in health insurance management who are a CEO of a health insurance company and they make $20 million. So that's why that number, that average number, is a lot higher than that middle point median number. But either way, these are excellent opportunities. A little bit more, this is information from the Bureau of Labor Statistics on salary information for health services administrators. And then again, states like California, Hawaii, New York, Massachusetts, District of Columbia tend to be the highest. I personally am from California, so you can see those are higher. Tennessee is a little bit lower, but when we look at the annual mean wage, Tennessee is still between 103 and 110,000 for health services managers. Now, getting that master's degree is key, because if we look at the starting salary, entry level is a lot higher for those who are entering with a graduate degree, almost double if you look at that compared to a bachelor's degree only. Now, what about community health? We started out this discussion about community and population health. Community and population health, the salaries are much more varied, from very, very low to very, very high, depending on the role, the community, the priority, your skill set, what you're able to accomplish. And so nonprofit agencies tend to have a lower budget, but they tend to have more flexibility and work-life balance and the ability to make an impact, and a little bit different expectations around professionalism, the times of day that you work, and things like that. Now, if you're interested in teaching folks about their health, conducting research, looking at health of certain populations, working with nonprofit agencies, being in the community, holding meetings to drive forward change, to influence the health of others, then community health is a great place for you. We've got a couple other examples. Another example is epidemiology. Epidemiology, many of us know what this is now that we've been through COVID. We know that epidemiologists work either directly tracking, doing contact tracing, tracking the spread of disease, but quite often doing the statistics and the trending and the investigation and the data collection around that disease, and deriving program recommendations of what we do now based on what we know about the disease and a disease progression. This is a salary outlook for an epidemiologist. You can see the 2020 mean pay was about 74K per year, a little bit lower than what we see with health services administrators, but the idea is this role isn't managing anybody. You don't have any staff to manage or goals like that. This is just a staff role, staff level role in a health department. We anticipate huge growth here, about 30% growth in this decade. Another example of a career in public health is environmental health. When we think about folks who are working to keep, again, our water, our food, our air clean, I've worked quite a bit on the air quality side in research, But there are folks who go into every restaurant, right? That's environmental health, right? And decide if it gets an A, B, C, D, and decides whether or not it's safe. So anything that we do to promote human health and well-being through fostering a safe environment can be considered environmental health. And so this is another area with a lot of different employment opportunities. And then we also have community health. And I know we talked about community health earlier, but I want to end there because that is what many of us are looking at taking a social and behavioral theories class. With community health, again, you could be working at an individual level as a health educator, educating individuals and populations. You could be working as a program director, creating programs for areas. You could be working with local agencies to push policy change forward, to get certain regulations put in place, to make streets safer, to prevent food deserts, right? The possibilities are endless. But if you want to work in community health education, I recommend a master's of public health, right? And there's some information here about salary outlook for MPH graduates. I also recommend a certified health education specialist certification through the National Commission for Health Education Credentialing. I have my master's certified health education specialist credential, so I'd be glad to talk with you about that. There's also another certification called the Certification of Public Health through the National Board of Public Health Examiners. That's a great option too. And so this is really should be part of your future plan if you're thinking about a career in social behavioral health. This will get you closer to working to advance the health of communities. All right. Well, thank you so much for listening to this brief lecture. I hope my little bit of addition about careers in public health and health services administration kind of adds to the brevity, the very brief nature of chapter 17, helps you think a little more holistically about career options. And once again, come see me as you're working through that process of looking at jobs and careers and grad schools and letters of recommendation. We want to make sure we get you there and you're where you want to be. All right. Thanks, everybody. Have a wonderful week.